Mr. O'Rourke for 5 minutes.
Thank you, Mr. Chairman. And I'd like to start by continuing a line of questioning begun by Dr. Rowe and Mr. Takano and others, and look at the local VHA facility level, the hospital or the clinic. And so many of us are concerned about a provider shortage and what it will take to attract and retain the best talent possible to serve the veterans that we represent. And so I'd like to understand how salaries and incentives are set for the providers, the doctors, psychiatrists, nurses, nurse practitioners, and others who actually provide the care to our veterans.
It is a complex process of calculations on market pay so that we can look at what the national pay is, and that is used in calculating what we recommend for pay. It's in addition to a base pay. So if we are talking about SESs and we talk about a Title V, there's no addition to any of their base pay. Our Title 38, which are our physicians and dentists, will receive, in addition to that base pay, this market pay, which we must do these calculations to, and then also they can receive a performance pay that has nothing to do with an award of performance, but it is a contract and objectives that they must meet in order to receive that performance pay.
And so apart from the formulas and the calculations, does the local VHA director have discretion to deviate from those formulas to attract or retain somebody who's needed in that community?
They can request recruitment incentives, and they can request relocation incentives or retention incentives. If it's someone that they have already on board they want to keep, they can request those type of incentives.
And is there any, I want to make sure I'm using the right words, we don't use bonus, but any incentive offered to a VHA director for returning money back to the VA or coming in annually under budget or not spending a certain amount or over a certain amount in a certain category?
There's not, I would not say, an incentive.
So no part of a VHA director's performance incentive is based on how they perform financially?
They would need to stay within budget, absolutely, but...
So there's a penalty for going over, but no reward for coming under?
Not that I'm aware of.
Okay. One of the things we're trying to figure out in El Paso is I brought this up repeatedly at this committee. We have a mental health care crisis, and one that was confirmed by the VHA audit released last week that showed that we are the worst in the country for setting an appointment for an existing veteran patient within the VA for mental health care, fourth worst for new patients, second worst for specialty care. And for those of us in El Paso, it's not a surprise. We've known it for a while. And what we've been told as providers and others within the VA in El Paso, in the VISN 18 that we're in, start to come to our office, in many cases anonymously, is a deep concern that the director is not providing those discretionary incentives to attract and retain people. So if we have these terrible performance measures in terms of being able to connect a veteran with an appointment, if we have a provider shortage, it was 19 and a half full-time employees when I started a year and a half ago. It was 13 and a half as of last month. I'm wondering how we can provide greater incentives or leverage or discretion to the local director to bonus or incent providers to get them or keep them in the first place. Any thoughts on how you might be able to do that, how the administration might be able to do that, or how we on the committee who are interested in this might propose if we need to change legislation to do this?
I would need to know what incentives they have already attempted to do, if they have, or if there's anything we can do to help them look at those incentives.
We, again, have an acute issue when it comes to providing mental health care at the El Paso VA. And we were told by an anonymous source within the VISN that until we really started to push on the director, he had not once deviated from the formula recommendation for what you pay someone to practice medicine at the VA in El Paso. And it was only through our pressure that there was this one deviation that ended up in hiring a much-needed psychiatrist to El Paso. It's very hard to get direct answers from the local VHA and even through the administration, as we've seen. I look forward to following up with you to find out what those formulas are, how we improve them or change them, what discretion there is, and how we hold people accountable for their performance, given the discretion and power that they already have.
Yes, Congressman.
Mr. Chair, I yield back.